We're going to be doing the manual muscle tests for Longus Colli and Longus Capitis. So first of all, we're going to go through Longus Colli, which is a cervical neck flexor, but does not act on the head. So what I'm going to ask my person to do basically, and I'm going to kind of assist her with that motion, is that she's going to lift her neck up off the table without moving the head's position, like so. And I'll just show you what I mean by the head position. So this would be capital flexion included with it, versus this would be capital extension included with that cervical flexion. So we're going to bring it back down, and I want you to lift up your neck, perfect, without moving the head's position. So it kind of looks like you're looking up and off into the distance, like where my hand is, like so. Okay, so can you please do that action on your own? So there is the active range of motion. Good, you can bring your head back down. For the break test, we are going to be pushing down on the head, but this is very paramount that you start off with less pressure and slowly add in pressure. And with my other hand, I'm actually going to be underneath the occiput, not supporting, but actually just as a safety precaution in case she starts to fail. So I'm going to have you lift your head up in that similar position, not quite as much. I'm going to place one hand across the frontal bone and one hand towards the occiput. I'm going to say, please don't let me move you, and I'm increasing my pressure as I push down. 3, 2, 1. Good, and let's bring the head back down towards the table. Please do not leave them up with their head up in the air for long periods of time prior to putting that resistance down, because you're actually challenging the muscle just to do that movement. There was quite a bit of shaking going on, and I didn't have to push too hard before that occurred, but that is very standard to have a weakness in these deep neck flexors. So we're going to finish with the concentric component of it. Again, hand across the frontal bone. They're going to lift up and keep going, keep going, keep going. And again, we allow them to complete that movement, and you're just assessing their ability to do active range of motion under resistance. Okay, I'm going to move directly into the Longus Capitis version of this test now. Very, very similar, but we're going to add the chin tuck, which is capital flexion. So they tuck the chin, you get the double chin look, and then they're going to look towards their feet. So they're going to look down towards their own toes with that movement. Got a little bit more T-spine than I wanted in that, but tuck the chin and there, and stop about there. So that is our active range of motion for the Longus Capitis. The resistance is going to be the same hand on the frontal bone with some support underneath the occiput. So they're going to tuck the chin, they're going to lift their head up just out of your hand, good, and hold that position as I start to push down. And again, with very minimal extra effort, we're starting to see some shaking in the front of the neck, which is a sign of some weakness. And let's bring the head back down. She's able to do that against gravity quite easily on her own, but with any added resistance. So we're getting into that low grade 4s to a 4 if I was to give this a manual muscle test grade. And again, I'm not going to resist the chin tuck, so she's going to do that on her own and then lift her head up, 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 and that's going to go through the concentric component. So that's going to be both manual muscle tests for the Longus Colli and Longus Capitis. Okay, so we have our person oriented right on the edge of the table. Their head is going to be going off the table into extension here. But what I want you to see is I'm actually bracing my elbow into my own thigh right now. So I'm not completely holding up the weight of the head. I'm actually supporting it through my own leg. So I'm going to use 2 hands for this, one hand on the neck and one hand on the occiput. As I'm going to lower this person's head down, the first thing that we're going to try to lengthen is Longus Colli, which does not act on the head. So I'm basically just going to be dropping the neck back into cervical extension. And I've already reached the end range of cervical extension. I'm thinking it's a little bit limited here, but that is when I get a tissue response. So I'm going to bring her back up into a neutral position. Let's do that again. So I'm just supporting the head, letting the neck drop down, and there we go, without having the head roll back. So this is the end of cervical extension for the Longus Colli length assessment. Now, if I want to transition that into a Longus Capitis, what I'm going to do again is roll the head back So there's capital extension, and then drop it posteriorly. I still have 2 hands on her head and on her neck, and that is feeling the end range for longus capitis, and as well as a lot of those central hyoids as a group from both supras and infras. Please take caution with a person's neck when you're going back into extension. I am sitting off to the side here, but I do like 2 hands on the neck and head for safety reasons at all time. In case one hand starts to slip, you always have a backup. So those are going to be the 2 length assessments for longus colli and longus capitis.